Antimicrobial resistance, often called AMR, is a growing global concern that threatens the effectiveness of medicines used to treat infections. When bacteria, viruses, fungi, or parasites change over time, they can become resistant to the drugs designed to kill them. This means that common treatments like antibiotics may no longer work as well, making infection harder to treat. As a result, illnesses can last longer, become more severe, and even increase the risk of spreading to others. Understanding AMR is the first step in recognizing why it matters to everyone, not just those in the medical field. Resistance develops when microorganisms are exposed to antimicrobial drugs such as antibiotics, antivirals, antifungals, or antiparasitics. Over time, some of these microorganisms adapt and survive, even in the presence of these drugs. These survivors can then multiply, passing on their resistant traits. This process is accelerated by the overuse and misuse of antimicrobial medications, such as taking antibiotics for viral infections or not completing a prescribed course. The more we use these drugs unnecessarily, the faster resistance can spread. Antimicrobial resistance is not just a local problem, it's a global health threat. Resistant infections can travel across borders through people, animals, and goods. This means that an outbreak in one country can quickly become a worldwide issue. The World Health Organization has identified AMR as one of the top 10 global public health threats facing humanity. Without urgent action, we risk returning to a time when minor infections or routine surgeries could once again be deadly. Modern medicine relies heavily on effective antimicrobials. Procedures like organ transplants, cancer chemotherapy, and even simple surgeries depend on antibiotics to prevent and treat infections. If these drugs lose their power, many medical advances could be reversed. Patients would face higher risks during treatments, and recovery times could increase dramatically. The loss of effective antimicrobials would change the landscape of healthcare as we know it. Infections are becoming increasingly difficult to treat due to resistance. Examples include tuberculosis, urinary tract infections, and pneumonia. In some cases, the bacteria causing these illnesses have become resistant to multiple drugs, leaving doctors with limited treatment options. These so-called superbugs can cause longer illnesses, more hospital stays, and higher medical costs. The rise of these infections highlights the urgent need for new solutions. Antibiotics are among the most commonly used antimicrobials. They have saved countless lives since their discovery. However, their widespread and sometimes inappropriate use has contributed significantly to the rise of resistance. Taking antibiotics for viral infections such as the common cold does nothing to help and only increases the risk of resistance. Responsible use is essential to preserve their effectiveness for future generations. Antivirals are drugs used to treat viral infections, such as HIV or influenza. Like antibiotics, overuse or improper use of antivirals can lead to resistance. When viruses mutate, they can become less responsive to these medications, making it harder to control outbreaks and protect vulnerable populations. Careful prescription and adherence to treatment guidelines are crucial in preventing antiviral resistance. Antifungal and antiparasitic drugs are also affected by resistance. Fungal infections, like those caused by Candida, and parasitic diseases such as malaria, are becoming harder to treat as resistance grows. This is particularly concerning in regions where these diseases are common and resources are limited. Ensuring proper diagnosis and targeted treatment is key to slowing the spread of resistance in these cases. There are several causes behind the rise of antimicrobial resistance. Overprescribing and self-medicating are major contributors. In some countries, antibiotics can be purchased without a prescription, leading to misuse. Additionally, poor infection prevention and control in healthcare settings, as well as the use of antimicrobials in agriculture and animal husbandry, play significant roles. Addressing these causes requires coordinated efforts from governments, healthcare providers, and the public. Antimicrobials are often used in agriculture to promote growth and prevent disease in livestock. However, this widespread use can lead to the development of resistant bacteria, which can then be transmitted to humans through food or direct contact. Reducing unnecessary use of antimicrobials in farming is an important step in the fight against resistance. Sustainable agricultural practices and better regulations are needed to protect both animal and human health. Environment also plays a role in the spread of antimicrobial resistance. Waste from hospitals, pharmaceutical factories, and farms can contain antimicrobial residues and resistant microorganisms. When these enter water sources or soil, they can spread resistance genes to other bacteria. Improving waste management and monitoring environmental contamination are crucial strategies in reducing the environmental impact of AMR. Our interconnected world, people and goods move across borders more than ever before. This means that resistant microorganisms can spread rapidly from one country to another. International travel, trade, and migration all contribute to the global spread of AMR. Effective surveillance and cooperation between countries are essential to track and control the movement of resistant infections. Patients' antimicrobial resistance can mean longer illnesses, more complicated treatments, and a higher risk of death. When first-line drugs fail, doctors must turn to more expensive or toxic alternatives, which may not always be available. This can lead to increased suffering and financial burden for patients and their families. Preventing resistance is critical to ensuring effective treatment options remain available. Economic impact of antimicrobial resistance is significant. Resistant infections lead to longer hospital stays, more intensive care, and increased medical costs. Productivity is also affected, as people may be unable to work while recovering from prolonged illnesses. The overall burden on healthcare systems and economies can be substantial, especially in low and middle-income countries. Investing in prevention and research is essential to reduce these costs. Surgical procedures and cancer treatments often rely on effective antimicrobials to prevent and treat infections. Without these drugs, the risks associated with surgery or chemotherapy increase dramatically. Patients may face life-threatening complications from infections that were once easily treatable. Protecting the effectiveness of antimicrobials is vital for the safety of these medical procedures. Certain groups are especially vulnerable to the effects of antimicrobial resistance. These include young children, the elderly, people with weakened immune systems, and those with chronic illnesses. For these individuals, resistant infections can be particularly dangerous and difficult to treat. Protecting vulnerable populations requires a strong focus on prevention, early detection, and appropriate treatment. Vaccines play an important role in reducing the need for antimicrobials by preventing infections in the first place. By lowering the incidence of diseases like pneumonia or influenza, vaccines help decrease the demand for antibiotics and other drugs. Expanding vaccination coverage is a powerful tool in the fight against antimicrobial resistance. Good infection prevention and control practices are essential in healthcare settings. This includes hand hygiene, sterilizing equipment, and isolating patients with resistant infections. By preventing the spread of infections, we can reduce the need for antimicrobials and slow the development of resistance. Everyone in healthcare, from doctors to patients, plays a role in maintaining these standards. Healthcare professionals have a responsibility to prescribe antimicrobials only when necessary and to choose the right drug, dose, and duration. This helps ensure that patients receive effective treatment while minimizing the risk of resistance. Education and guidelines for prescribers are important tools in promoting responsible use. Educating patients about the proper use of antimicrobials is crucial. Patients should understand why it's important to complete the full course of treatment, even if they feel better. They should also know not to share medications or use leftover prescriptions. Empowering patients with knowledge helps prevent misuse and supports the fight against resistance. Tracking the spread of antimicrobial resistance is essential for effective response. Surveillance systems collect data on resistant infections, helping health authorities identify trends and outbreaks. This information guides public health actions and policy decisions. Strengthening surveillance is a key part of the global strategy to combat AMR. Developing new antimicrobials, diagnostics, and alternative therapies is vital to staying ahead of resistance. Research also focuses on understanding how resistance develops and spreads. Innovation in this field can lead to breakthroughs that save lives and protect public health. Supporting research is an investment in our future ability to fight infections. Many countries and international organizations have developed action plans to address antimicrobial resistance. These plans focus on improving awareness, strengthening surveillance, promoting responsible use, and investing in research. Global cooperation is essential, as resistance knows no borders. Working together increases our chances of success. Healthcare workers are on the front lines of the fight against antimicrobial resistance. Their actions, from prescribing medications to educating patients and practicing infection control, have a direct impact on resistance rates. Ongoing training and support help ensure that healthcare workers are equipped to make the best decisions for their patients and communities. Communities play an important role in preventing the spread of resistance. Simple actions like practicing good hygiene, getting vaccinated, and using medications responsibly can make a big difference. Community awareness campaigns help spread the message and encourage collective action. Everyone has a part to play in protecting public health. Pharmaceutical companies are essential partners in the fight against antimicrobial resistance. They invest in developing new drugs and diagnostics, but face challenges due to high costs and uncertain returns. Incentives and partnerships can help encourage innovation and ensure a steady pipeline of new treatments. Collaboration between industry, governments, and researchers is key. Strong policies and regulations are needed to control the use of antimicrobials in both human health and agriculture. Governments can set standards for prescribing, monitor drug sales, and enforce restrictions on over-the-counter availability. Effective regulation helps prevent misuse and supports the responsible use of these vital medicines. One Health approach recognizes that human, animal, and environmental health are interconnected. Addressing antimicrobial resistance requires coordinated action across all these sectors. By working together, we can develop comprehensive strategies that protect health at every level and reduce the spread of resistance. Antimicrobial stewardship programs are designed to optimize the use of antimicrobials. These programs promote the right drug, dose, and duration for each patient, helping to preserve the effectiveness of existing treatments. Stewardship involves collaboration between doctors, pharmacists, and other healthcare professionals, and is a cornerstone of resistance prevention. Accurate and rapid diagnostic tests help ensure that patients receive the right treatment for their infection. By identifying the cause of illness quickly, doctors can avoid unnecessary use of broad-spectrum antimicrobials. Investment in better diagnostics is a key strategy for reducing resistance and improving patient outcomes. Researchers are exploring alternatives to traditional antimicrobials such as phage therapy, probiotics, and immunotherapies. These approaches offer new ways to treat infections without contributing to resistance. Continued research and clinical trials are needed to determine their effectiveness and safety for widespread use. Technology plays a growing role in tracking and combating antimicrobial resistance. Digital health tools, data analytics, and artificial intelligence can help identify outbreaks, monitor drug use, and predict resistance patterns. Embracing technology can make our response faster and more effective. No single country can tackle antimicrobial resistance alone. International collaboration allows for the sharing of data, resources, and expertise. Joint efforts can lead to coordinated responses to outbreaks and the development of global standards. Working together increases our ability to protect everyone's health. Public awareness campaigns are vital in educating people about the dangers of antimicrobial resistance and how to prevent it. These campaigns use media, schools, and community events to spread the message. The more people understand the issue, the more likely they are to take responsible actions. Low and middle-income countries face unique challenges in addressing antimicrobial resistance. Limited access to healthcare, poor infrastructure, and lack of regulation can make it harder to control the spread of resistance. International support and investment are needed to strengthen healthcare systems and ensure everyone has access to effective treatments. Failing to address antimicrobial resistance could have devastating consequences. Without effective drugs, common infections could become deadly and medical procedures would become much riskier. The economic and social costs would be enormous, affecting individuals, families, and entire societies. Taking action now is essential to prevent a future crisis. Some countries have made significant progress in controlling antimicrobial resistance. For example, strict regulations on antibiotic use, robust surveillance systems, and public education campaigns have led to lower rates of resistance. These success stories show that with the right strategies, it is possible to make a difference and protect public health. Each of us has a role to play in preventing antimicrobial resistance. By following our doctor's advice, practicing good hygiene, and never demanding antibiotics unnecessarily, we help protect ourselves and others. Small actions, when multiplied across millions of people, can have a big impact on public health. The future of antimicrobials depends on our actions today. Continued investment in research, responsible use, and global cooperation will determine whether we can stay ahead of resistance. With innovation and commitment, we can preserve these life-saving drugs for generations to come. Children are particularly vulnerable to the effects of antimicrobial resistance. Infections that were once easily treatable can become life-threatening. Ensuring access to effective medicines and promoting vaccination are crucial steps in protecting children from resistant infections. The elderly and those with chronic illnesses often have weaker immune systems, making them more susceptible to resistant infections. Extra care is needed to prevent and manage infections in these groups. Regular checkups, vaccination, and prompt treatment are important strategies for their protection. Animals, both livestock and pets, can be affected by antimicrobial resistance. Responsible use of antimicrobials in veterinary medicine is essential to prevent the spread of resistance from animals to humans. Good animal husbandry practices and regular veterinary care help keep animals healthy and reduce the need for drugs. Protecting the environment from antimicrobial contamination is an important part of the fight against resistance. Proper disposal of medications, reducing pharmaceutical waste, and monitoring water sources can help limit the spread of resistance genes. Environmental stewardship benefits both human and animal health. Despite the challenges, there is hope in the fight against antimicrobial resistance. Advances in science, increased awareness, and global cooperation are making a difference. By working together and staying committed, we can protect the effectiveness of antimicrobials and ensure a healthier future for all. Fight against antimicrobial resistance requires action from everyone: individuals, healthcare professionals, governments, and industries. By making informed choices, supporting research, and promoting responsible use, we can all contribute to the solution. The time to act is now to safeguard the medicines that protect us all.